Hello everyone, my name is Divanshu. Welcome to the channel GDC English. So in this video, we do have a new topic that is antihypertensive drugs. In this video, we're going to go through the MCQs behind this chapter. So I hope your progress is going well. And from this video, we'll have some new questions. Okay. So let's start with the new questions. So first part is antihypertensive drugs. Second part will be the anti-anginal and anti-arrhythmic drugs because these topics are very important for your exams, whether it is GPAT, NIPER, or any pharmacist exam. So let's start with the first question. So the first question saying that read the following sentence regarding hypertension. So there are four options. First one, hypertension is the elevation of systolic or diastolic BP above 140 by 90 mmHg. First point, okay. Cause of primary hypertension is due to conditions like renal endocrine or vascular disorders. Okay. Third point is cardiac output and total peripheral vascular resistance are the two parameters used to determine the blood pressure. Okay, nice. Then blood pressure is controlled by baroreceptors, reflexes acting through the autonomic nervous system. So out of these, you have to read the sentences and click the right combination. Out of these four statements, which statements are right? So the first option is P and Q, second option is Q and R, C option is Q only Q, and D option is P, R, and S. You have 10 seconds to answer. Answer wisely. Okay. So let's move towards the explanation part. That first statement is saying hypertension is the elevation of systolic and diastolic BP. That one is right. So whenever a patient having increase in blood pressure around 140 to 90 mmHg, that patient is to be considered as the hypertensive patient. So P is right. Cause of primary hypertension is condition like renal, endocrine, or vascular disorders. No, this one is wrong because primary hypertension, the cause is never known. It is idiopathic in nature. You never know the answer. You never know the reason behind the primary hypertension. There are reasons of secondary hypertension, which is like renal or endocrine or vascular disorders. These are secondary, not primary. So this belongs that Q is not a correct option. Let's move to the R statement. The cardiac output and total peripheral vascular resistance are the two parameters used to determine the blood pressure. Yes, it is right. How? Because BP is equal to what? Cardiac output into TPR, total peripheral resistance. Acha, can you tell me the cardiac output of heart? What is cardiac output and what amount of blood that it actually pumps in 1 minute? Okay, so you have to write the answer in comment section. Okay, so this one is also right. S1. Blood pressure is controlled by baroreceptor reflexes acting through the autonomic nervous system. Yes, this is also right. That we do have a baroreceptor reflexes in our body that regulates the blood pressure. So out of which we do have Q as a wrong option. Rest of R are right. So we do have P, R, and S will be right one. Okay. Yes. Here you can see the PRNS is right. Okay. So let's move to the next question, that which of the following amino acid is present in the captopril? So can you tell me captopril is a short acting or the long acting? Write in the comment section. Okay. So which amino acid is present in captopril? Glycine, cysteine, proline, para-amino benzoic acid. So let's move towards the answer, that proline is there in captopril. Acha, can you tell me that what kind of amino acid is present in glycine? It is a neutral in nature. Neutral. Cysteine is having basic in nature, and it also have the SH group, that is sulfhydryl group. Okay. Proline is not an amino acid. It is an amino acid. Okay. Amino acid. So proline is generally present in the captopril. Okay. not centrally acting antihypertensive drug is? So you have to answer which is not an centrally acting antihypertensive drug. First one is methyl dopa, second one is clonidine, and third one is minoxidil, and fourth one is guanabens. So the right answer is minoxidil. Minoxidil is not a centrally acting antihypertensive drug because minoxidil is a arteriodilator. Arteriodilator. It dilates the arteries, not veins. Okay. Specifically, it dilates the arteries. How? Because it will open the calcium channel. It is in potassium channel opener. It is in potassium channel opener, which will lead to the arteriodilation. Okay. Rest of the drugs are centrally acting. Clonidine is an alpha 2 agonist. This question is asked by many times in the exam that what kind of drug is clonidine? On which receptor this clonidine acts? So, alpha 2 agonist. Okay. An alpha 2 agonist is a GI mediated receptor. Okay. So, clonidine is alpha 2 agonist. Clonidine is an alpha 2 agonist which is centrally acting. Methyl dopa is the safest drug. Okay. You should mention that in your notes. It is a safest drug. It is one of the safest drug in pregnancy. Okay. So can you tell me the answer that what kind of drug is safest in emergency antihypertensive? Okay. Emergency hypertension crisis in pregnancy. So I will tell you answer that hydralazine. Hydralazine is also an arteriodilator which is used in emergency hypertension in pregnancy. In pregnancy. This question is very important. Out of this, in this question, you have two more questions. That first one is which is the safest drug in pregnancy? That is methyl dopa. And which is the safest drug in emergency hypertension in pregnancy? That one is hydralazine. Okay. Let's move to the another one. So, inhibition of conversion of the following is the mechanism of action of angiotensin converting enzyme inhibitor. That is ACE enzymes. ACE enzyme inhibitor. So, which class of drugs will be in these ACE inhibitor? Captopril, lisinopril, ramipril, enalapril. No. So, these kind of drug will be in the ACE inhibitor. So, what actually it do? Okay, it will just restrict the conversion. Conversion of what? Conversion of angiotensin 1 to angiotensin 2. How will it goes like? It goes like that renin just releases from the JF, juxtaglomerular cells, JG cells of kidney. JG cells of kidney. And this renin is responsible for the conversion from angiotensin to angiotensin 1. Okay. Now, this AG1 gets converted into the AG2. AG2. Okay. Now, what kind of enzyme is usually converting this AG1 and AG2? That is ACE. That is angiotensin converting enzyme. Now, this angiotensin converting enzyme inhibitors, just like captopril, lisinopril, ramipril, these are inhibiting what? These are inhibiting this enzyme, which ultimately leads to what? It will generally leads to the no formation of AG2. This AG2 further directly goes into the direct vasoconstriction property. It do directly have vasoconstriction property. Also, it will bind to the angiotensin receptor, that is ARB. And this angiotensin receptor has a more aldosterone-like activity. Aldosterone like activity, and this will responsible for the sodium potassium and sodium water retention in the body. This will leads to what? This will leads to the increase in BP. Okay. So generally it is the enzyme which are converting AG12 into the AG2, that is but specifically gets inhibited by these angiotensin receptor blocker, that is ACE inhibitor, ACE enzymes, ACE enzyme receptor, ACE enzymes inhibitor. Okay. Now, so this was the answer, that AG angiotensin 1 to angiotensin 2. Next. Now we have, which of the following statement is the incorrect about the enalapril. Okay. Now, so first option, they are safe in pregnancy. Dry persistent cough is the most common side effect. Its absorption is not affected by food. It is a prodrug. So out of these, there is a one incorrect statement about enalapril. So you have read in every time that ACE inhibitors are very much teratogenic in nature. Okay, teratogenic. Teratogenic means what? That these types of drugs which will be affected onto the fetus. Okay, so they are not safe in the pregnancy. Even you can say that the first option is not correct. They're not safe in pregnancy because these are teratogenic in nature. Persistent cough is the most common side effect. Yes, because of the bradykinin. Because of the bradykinin. Bradykinin. Bradykinin is responsible for the dry cough. Okay, its absorption is not affected by food. Yes, because one of the um, these are the drugs which are comes under the ACE inhibitors. These are not affected by food. It is a prodrug, yes, because enalapril has an anti-metabolite. It has a metabolite, that is enalaprilate. Okay, enalaprilate. Now, yes, these are safe in pregnancy. Which of the following can reduce cough caused by ACE inhibitor? Okay, in the previous question also we have just discussed that what does ACE inhibitor do? ACE inhibitor with bradykinin, it will do the cough, dry cough. So out of which of the drug can reduce these cough caused by ACE inhibitor? Okay. So this question is very nice, that aspirin is itself just inhibiting the PG synthesis. Okay. This PG synthesis is get inhibited by the aspirin and also has some inhibitory effect on cough reflexes induced by bradykinin. Okay, so aspirin has the only effect on the cough reflexes induced by bradykinin. Here bradykinin is not treating the dry cough, it exaggerating the dry cough conditions induced by the ACE inhibitor. Ambroxol and bromohexine, these are all like mucolytic in nature. Okay, so yeah, answer must be aspirin. Okay, chalo. So choose the correct adverse effect of captopril. Captopril is itself an ACE enzyme inhibitor. Okay, so dry cough, yes. Proteinuria, yes. Dysgeusia, dysgeusia means what? Means the altered taste. Okay, altered taste. Yes, so you will have the all of these. These all are the adverse effect of captopril. Okay, now this might be your very favorite questions, no? So out of which you have to choose the correct combination. Just choose it wisely. So here we do have first one is clonidine. Clonidine generally has a central sympatholytic effect. We just discussed in previous questions. Phentolamine. Phentolamine is a what? It is a alpha blocker. Alpha blocker. Hydralazine. Hydralazine is a arteriodilator. Aliskiren is a renin inhibitor. Okay. So now clonidine is going like to 1D. So clonidine is 1C. Okay, 1C, 1C. So this has 1C and 1C. Okay, now phentolamine. Phentolamine has alpha blocker, that is 2D. 2D, 2D, yes, 2D. Okay. So this option is right. Okay, next, hydralazine is arteriodilator. Yes, it is an arteriodilator. Now, L-ascarin is an renin inhibitor. So that renin, which generally product produced by the JG cells of kidney in the response of low blood volume. Okay, generally renin is produced by JG cells only the presence of low blood volume. It is inhibited by the L-ascarin. L-ascarin is a nona peptide, which is which peptide? Nona peptide. Peptide? No, it is not a nona peptide. It is a non-peptide in nature. Non-peptide in nature. Okay, it is a non-peptide in nature. It generally asks in exams. It has asked in exam that which kind of peptide is L-ascarin in nature. L-ascarin is non-peptide, not a nona-peptide. Nona-peptide are oxytocin, and you can say that ADH or vasopressin. Okay, these are the nona-peptide in nature, that it has a 9 peptides. Okay, hydralazine, just we have discussed that hydralazine is used in the emergency condition of hypertension in pregnancy. Okay, phentolamine is generally cause cheese reaction. This is very important. Cheese reaction. Phentolamine is generally causes cheese reaction. It has an adverse effect of cheese reaction. Okay, so the correct option is D. Now, so again, statement wise questions. Angiotensin receptor blocker antagonize the action of angiotensin 2 on target cells. Okay. Direct renin inhibitor prevent generation of the active principle angiotensin 2. So this is up to you. Now you have to answer that which one is right. You have 5 to 10 seconds. You have to answer which statement is right. This is very easy questions for you guys. Okay. Answer it. I think you have answered right now that statement 1 should be very much right. Because why? This direct renin inhibitor, which is L-ascarin, prevent generation of the active principle angiotensin 2? No. It generally inhibits the prevention generation of what? Renin. Here only it is just giving you an answer. Okay. So statement 1 is angiotensin receptor blocker antagonize the action of angiotensin 2 on target cell. Yes. What kind of drug come under these classes? Losartan, candesartan, telmisartan. Okay, so these kind of drug comes under the angiotensin receptor blockers. Okay, so these just antagonize the action of angiotensin 2 on target cell. Whereas direct renin inhibitor, that is L-ascarin, it is not inhibiting the generation of angiotensin 2. It is generally inhibiting the generation of renin. Okay, renin only. So which statement would be right? Which statement would be right? Statement 1 would be very much right. Okay. Now, all of the following are usage of ACE inhibitors except. Okay, this is a very factual question. Fact wala question, no? So in diabetic nephropathy, yes, it generally prevents the diabetic nephropathy because it prevents the proteinuria. It generally prevents the proteinuria. Okay. Also, if we talk about hypertension, no, except it generally it generally act on the hypertension, not hypotension. Okay, because it will generally reduce what? It will generally reduce the generation of angiotensin 2, which are responsible for the increase in sodium and water volume inside the body. Okay, so it is not used for hypotension, it is generally used for the hypertension. Myocardial infection, yes, in myocardial infection, that is the CHF, cardiac heart failure, it is used in that because it prevents the cardiac remodeling. Okay, it is a cardiac remodeling. Scleroderma crisis, specifically Captopril. Just write in your notes that Captopril is generally safest drug for scleroderma crisis. Okay. So hypertension will not be an answer in this, right? Now, which of the following is a ARB is a pro-drug? Which of the following ARB is a pro-drug? Telmisartan, losartan, valsartan, olmesartan. So it is a very much controversial question that you must have heard that losartan has an active metabolite that is candesartan. No? Yes. Valsartan? No. Telmisartan? No. But olmesartan? Yes. Olmesartan has a active metabolite. Which active metabolite? That is olmesartan, medoxomil. Generally, olmesartan medoxomil is given orally, and this have an active metabolite which is olmesartan. Okay, so olmesartan would be your right. Next question. So losartan was the first orally active AT1 receptor antagonist to be developed. Yes, it is in prototype drug. Losartan is a prototype drug of angiotensin receptor blocker. Now, the affinity of losartan is 1000 times and valsartan 20,000 times more for AT1 receptors than AT2 receptors. Yes, both the questions are very much right that losartan was first orally active AT1 receptor antagonist because losartan is a prototype drug, of angiotensin receptor blocker. Yes, and second statement is very much factual in nature. That is, losartan is 1000 times and valsartan is 20,000 times more potent for AT1 receptors as compared to the AT2 receptors. Okay, so both statements are correct. Now, pharmacologically, ARB differ from ACE inhibitor in the following ways, except. Okay, so which one is a not a difference between in this? Okay, so first one option is ARB interfere with the degradation of bradykinin and other ACE substrates. Okay, ARB like losartan cause fall in BP in hypertensive patient which lasts for 24 hours while HR remains unchanged. Okay, ARB cause little increase in the level of angiotensin 1 which is raised by ACE inhibitors. Okay. ARB causes fewer side effect as compared to the ACE inhibitors. Okay. So in this, you have to click the wrong difference, particularly which difference is not there. There are no difference. Which one has a no difference between ACE inhibitor and ARB? Okay. So out of four, there are three differences, major differences between ARB and ACE inhibitors. First one, ARB interfere with degradation of bradykinin. Nah, because it is not involving the degradation of bradykinin. Particularly the ACE inhibitors are responsible for bradykinin degradation, not ARB. Okay, so itself, first one is very much wrong. Yes, ARB interfere with degradation of bradykinin and other ACE substrates are the wrong difference. Okay. Now, according to NICE 2011 guidelines, ARB are preferable over ACE inhibitors for which of the following? Okay, so which one? NICE is what? NICE is a National Institute of Healthcare, and Excellence. Okay, so it is generally belongs from UK, United Kingdom. UK. Okay, so it says that ARB are much preferable over ACE inhibitors for which of the following? So it is a very much factual question that ACE inhibitors are not that much efficacious for black races people. These black races belongs from African countries and Jamaican countries. Jamaican, that is a Caribbean countries. Caribbean. Caribbean countries. Says what? Because these ACE inhibitors are responsible for the angioedema. Angioedema. This angioedema is a classical example of adverse effect of the ACE inhibitors. Okay, these ACE inhibitors are generally causing the angioedema, that is swelling of lips in the black rhesus people, which generally belongs from Africa or Caribbean countries. Okay, also this is not the one um, example. Second example is also there, that ACE inhibitors are not very much efficacious, not efficacious in reducing the BP in black races. Okay, so these two uh, differences are there between ACE inhibitors and ARB. That's why ARB is very much preferred over the ACE inhibitors onto the black races people, which are generally is, belongs from African or Caribbean countries. Yes, black races. Which of the following about clonidine is false? It is an alpha adrenergic agonist. It can cause dry mouth as an adverse effect. Prazosin completely antagonizes its action. It inhibits sympathetic outflow. This is a very easy question for you guys. That out of four, there is a one wrong answer. So you have to take one that. Okay. So first option is saying that it is an alpha adrenergic agonist. Yes, it is an alpha 2 agonist. Yes. It can cause dry mouth as an adverse effect. Yes, it can cause a dry mouth. Prazosin completely antagonizes its action. No, because prazosin is a selective alpha 1 antagonist. It do have no role on the alpha 2 receptor. Okay, it do have no role on alpha 2 receptor. So this option is very much wrong. It inhibits sympathetic outflow. Yes, from this only it is lowering down the PP. Okay, so prazosin is a selective alpha 1 antagonist. That's why it has no role on alpha 2 receptor. So it do have a no interaction between clonidine and prazosin. Okay, next question is, reserpine is used in hypertension only in low dose because it is a very strong antihypertensive. Side effects become disproportionately marked. High doses on chronic use cause addiction 2 to 5%. Side effects becomes disproportionately marked. This will be your right answer. Okay, so in this type of GPAT or NIPER exam, generally reserpine is not asked from the pharmacologically point of view. It generally asks from the pharmacognosy. Okay, so this kind of question is not very much important for you, but you can just remember that in low doses, reserpine is used because side effects gets lower down. Okay, losartan is what? Losartan is selective and AT1 receptor antagonist, NT2 receptor antagonist, non-selective antagonist, or AT1 receptor partial agonist. It is an selective AT1 receptor antagonist. Okay, just we have discussed before. In the treatment of hypertension, the beta adrenergic blocker have the following advantages. They have minimal effect on work capacity, sleep quality, and libido. They do not cause postural hypertension. Used alone, they have ceiling antihypertensive efficacy. They can be used in combination with any other antihypertensive drugs. Okay. So the answer is they do not cause postural hypertension. So what is postural hypertension? So particularly, for example, when I'm sitting on a chair, all of a sudden when I just lift my body up to stand, all of a sudden I will just feel like dizziness. Okay. We'll see that the whole world is just revolving around my side. I will just seeing the stars around myself. That is just causing the postural hypertension. Okay. All of a sudden your BP gets low down. That is called postural hypertension. Whenever you just stand up from your bed or any chair, your BP gets low down all of a sudden. Okay. So advantages of beta blocker, it generally not causes postural hypotension. Okay. They can be used alone? No, it not does not generally given alone. All of the BP's medication are generally given through combined therapy. Whether, for example, that amlodipine. Amlodipine is a calcium channel blocker. It is inhibiting the contraction of heart, slowing down the contraction of heart. Okay, decreasing the workload. Whereas telmisartan is an angiotensin receptor blocker. It is acting on the RAS system, renin-angiotensin aldosterone system. Okay, it inhibiting the water retention inside the body. So multiple combination of the drugs are given generally to the hypertensive patients. So next one is generally from the diuretics part. So identify the wrong combination of option. Okay, this is quite interesting that you have to take the wrong combination of option after reading the statements regarding the use of diuretics in hypertension. Okay, so diuretic enhance the excretion of sodium and water resulting in reduced plasma volume. Okay, this one is very much right option. Thiazides are first line antihypertensive and are inexpensive. Okay, this much is very much right. Restriction of dietary salt intake will increase the dose of the diuretic needed. Okay. Loop diuretics are avoided in hypertension with chronic renal failure or congestive heart failure. No, this R and this S is a wrong option. Okay, R and S are the wrong option. Here, this restriction of dietary salt intake will increase. No, not it will not increase, it will decrease the dose of diuretic needed. Okay, because ultimately you will just reducing your dietary salt. It will affect what? It will automatically reduce your BP. So what will be needed further? So you do just have to lower down the dose of your diuretic. Okay, loop diuretics are avoided in hypertension with chronic renal failure. No, it is also a DOC, that is drug of choice in renal failure. It is written totally opposite. Loop diuretics are the DOC in renal failure. This has been asked in very much times in your exams, that which kind of diuretics is the DOC in renal failure. So loop diuretics are the DOC in renal failure. Okay. So both R and S are wrong combination of options. 40. Okay. 20th question. Labetalol, valsartan, triamterene, doxazosin. Okay. And mechanism of action is written in the next column. Okay. So labetalol is a mixed alpha and beta blocker, correct? Valsartan is an angiotensin receptor blocker, correct? Triamterene is an potassium sparing diuretics, yes. Doxazosin is an alpha blocker. Okay. Now labetalol is going where? Now labetalol is going to mix AB, that is first ka Q. Now you have got the answer. But for the safe side, you just also go through the other options also. Labetalol Q, valsartan, valsartan S, yes. Triamterene P, yes. Doxazosin, alpha blockers. Okay. So these are the 20 questions that are very much important for your GPAT, NIPER or pharmacist exams. So I hope I made you clear around this video, around these MCQs, and I hope your progress is going very much well. You just have to grind yourself, grind every day, each day, and one day you will just see the results of your grinding. Okay, that must be very fruitful to you. So, in this video, we're just ending now, and from the next video, we do have anti angina, anti arrhythmic drugs. So, till then, keep revising and stay with GDC. Thank you so much.